Wes Streeting's bid to get Britain off the couch and save the National Healthcare Service £10 billion. I'm going to read into this exclusive from the iPaper, you guys. So it says the Health Secretary is to get Britain moving campaign could be undermined by difficulties to walk in some areas. So we do still have we do have obesity issues in the UK. We do have the trouble of obviously a lot of people with health issues, health conditions, and we really want to try and help them as much as we possibly can to encourage them to eat a healthier food, to get fit and all that kind of stuff. And it's really, really important. And one of the ways they want to try, their health secretary wants to try and do that is try to get people walking, get people moving, especially people who may be just sitting on the couch, sitting behind a computer screen and not really doing much fitting or exercise for themselves. It's really, really important that you do some form of exercise in some way, shape or form. For example, I like to try and do 10,000 steps a day, me personally. I try to do it every day. I can't do it every day, unfortunately, but I do try to do it every single day. I go for a long walk around the park because I spend a lot of time sitting on the chair, which is not very good. But every now and then I think like after an hour or two, I'll get off, step away from the chair because obviously it's not very good for, it's not very ideal to be sitting on a chair 24/7. It's really, really not. But everyone's situation is obviously different. But that's my situation. But I don't consider myself having health issues. But obviously some people do, and how we can help them is very, very important. Especially if people are having to rely on medicine and things that cost the National Healthcare Service. Anything that can save the NHS money, as it says here, would be a good thing. But not everybody can walk in certain areas. So every area and every part of the UK is different. So, but of course, I'm all in favour of helping people get more healthy and be more fit, be more active, and be less reliant on the National Healthcare Service. But it's all about how you approach it. And sometimes it's not always a case of just throwing money at the problem. So let's read a bit more into this. So, millions of Britons will be encouraged to walk or run regularly as ministers step up plans to curb obesity to save the NHS billions. The Health Secretary, Wes Streeting, is to work with Sir Bernard Foster, the former long-distance Olympic medalist and founder of the Great North Run, on a Get Britain Moving campaign. The campaign will attempt to motivate people who do not normally take regular exercise or to fit walking or running into their weekly routines. The government will also run an annual competition to find the UK's most physical active community, modelled on the UK City of Culture Award, in an attempt to boost public participation. It is part of Streeting's major strategic shift, 1 in 3 at the heart of his plans to reform the NHS from sickness to prevention, outlined in the government's 10-year health plan published in July. A survey at the Nuffield Health last year found that 3 in 4 people were not reaching NHS recommended 150 minutes of modern exercise a week and around 20 minutes a day, while 1 in 3 had not dedicated any time to vigorous exercise in the previous 12 months. That's really bad if you haven't done any kind of rigorous exercise. Every now and then I'll try and do my 10-minute workout. I don't do it every day, but every now and then I'll try and do some of that, and that really just keeps the blood and body flowing, sort of thing. With the lack of motivation cited as the most common barrier to physical activity. Yeah, this is the biggest barrier here. When it comes to the psychological part. Walking or running is often considered the ideal activity for those who do not normally exercise, as it is inexpensive and does not require specialised equipment beyond suitable shoes or trainers or comfortable clothing. It can be done anywhere, such as local park or neighbouring streets. Yep. The obesity problem in figures. So in 2023-2024, 64.5% of adults aged 18 years or over in England were estimated to be overweight or living with obesity. In 1993, the proportion of adults overweight or obese was 52.9%. This is higher than in 2022-2023, that's 64%, with an overall upwards trend since 2015 to 2016 at 61.2%. The National Child Measurement Programme, the NCMP, found that 9.6% of reception-aged children in England, ages 4 to 5, were obese in 2023-2024, with a further 12.4% overweight. Overall, 26.8% of children aged 2 to 5 were overweight or obese in 2022-2023, a report published this year by the House of Commons has shown. The experts warned that the idea of nationwide fitness campaign was a positive step. Britain lacks the infrastructure and physical activities culture for regular exercise. Foster, who was European 500-metre champion and Commonwealth 10,000-metre champion, as well as an Olympic bronze medalist, is to assemble a group of experts to set up the campaign. While the Get Britain Moving is not directly inspired by the Trump administration, it has echoes of Robert F. Kennedy Jr.'s recent attempts to motivate Americans to take up regular exercise as part of his Make America Healthy Again. One of the things that Robert Kennedy Jr. is trying to do, and by the way, I think his intention is actually to kill people rather than help people in America. That's what I'm stating with what were some of the actions that he's taking. His main goal is not about making Americans healthy again. He's about getting them off medicine and getting them is stop relying on the state, basically, just to stop relying on the state when it comes to your healthcare is what he's trying to do. Which I employed him to do. I employed it to him, but taking away certain medicines that actually could be the difference between life and death, that's very questionable there. On the summary of Kennedy Jr. in denim and cowboy boots, and Defense Secretary Pete Hegseth urged Americans to follow their example by doing an intensive workout of 100 press-ups and 50 pull-ups in just under 5 minutes. That's not something everybody can do. It's all well and good saying that you can do that, but not everyone can do that. Unless frantic pairing, Streeting teamed up with Joe Wicks, the fitness coach and TV presenter this summer, to launch an animated series called Activate to inspire children to do 5-minute workouts. Sources close to Streeting said the health secretary would not be hitting the gym in his jeans as part of the fitness campaign, however. The Get Britain Moving campaign is designed to work alongside other government efforts to reduce obesity and improve the nation's public health, including expanding access through the NHS to weight loss jabs. Just going back on the 5-minute workout for children, it depends what the workout is, if it's something really small. Obviously, it would be nice if that was something done in schools. If that was something that they could give 5 minutes to, making all the kids just do a 5-minute workout. I think that would be really, really a good thing, if possible. I wouldn't want to just throw it on parents to encourage them to do it to their children, because not every parent is going to be able to do that. Parent or guardian, sorry. Insider said improving people's fitness will also feed into the government's overall mission to boost economic growth, with a more physical, active workforce taking fewer sick days. Yeah, that is true. That is 100% true. Ministers also plan to push ahead with the plans to create plans called NHS Points, which will offer people rewards for hitting the target step count and other healthy behaviours. This is a great idea. This is one way to incentivize people. If you can I love this idea. This is one way to encourage people to get to exercise. Incentivize. If you can incentivize people and reward people when they are doing something, it encourages them to do it more. And if you for rewarding people for hitting step counts and all that kind of stuff, that will encourage people. That will definitely encourage more people, because it will push people to say, "Oh, look what you can get out of it." So I like this idea. The point system was set out in the 10-year plan, but a pilot study in Wolverhampton produced mixed results, showing that offering financial incentives did not impact participants' level of physical activity, according to a review of the pilot published in August. Okay. Well, I still think it should be worth... I still think we should... okay, so they did a pilot and didn't work out there. It may be the case that trying a different area, maybe some... It depends in the areas. I still think it's a good idea, personally. The 10-year health plan says being physically active is good for physical and mental health and has a measurable positive impact on reviving NHS pressures, worth an estimated $10.5 billion in savings a year. Despite that, inactivity levels remain stubbornly high for adults and children, with hugely inequalities across the country. The government wants to link exercise where people live and so-called place-based approach to physical activity, after research from Sports England showed that where investments in physical activities were designed with local people, inactivity rates were 2.5% points lower than otherwise in the most deprived places. The Department of Health, and Department of Culture, Media and Sports will jointly lead across the government drive to physical activity on a local level. This includes $250 million MRF investment into 100 places by Sports England, and at least $400 million of investment into local community sports facilities and new partnerships on school pass and local health plans. You know what else they could do is make sure they could make sure that areas making sure that communities that have already been run down and get them back reopened as well. There's a lot of community centres that have been lost, making sure that they're getting open back up as well. Dr. Florence Spotswood, Associate Professor in Marketing and Consumption at the University of Bristol Business School, said the nationwide fitness campaign was absolutely the right direction of travel, adding, "I totally support in the sense of what we should be spending our public health policy fundings on, generating an active nation." That's Spotswood, whose research focused on people experiencing experience of leisure time, physical activity, and how these are shaped by marketing, said the government cannot just come out and tell citizens that they should be making better choices. I think we need to think about physical activity in much more serious ways of how it fits into British society. Yeah, like I said, there's a psychological and mental barrier to this as well. She added, "For me, it just smacks in every other public health physical activity and campaign there has ever been. There's a reason why we as a nation are not physically active. It's not built into our fabric in our everyday lives. And I've just come from the Alps. The whole system there is set up for sport. There is easy access to cheap physical activities. There's experience that you will cycle or walk. We don't just have that in the UK. It is not built into the fabric. It can be difficult to walk places, particularly in deprived communities. We're worried about our safety. If you go into the woods, there are no signposts. Spotswood said marketing campaign to improve nation's fitness needed to make people believe in it. She cited the Girls Can, a national lottery-funded campaign to improve women and girls' physical activities, launched in 2015. It's a great example because it gives women a language that they could play with. It says that they can enjoy sports and physical activities. What this girl can got right is that it didn't treat all women the same or all girls the same. Spotswood added, if you want a 16-year-old lad on a council estate to start running, that's a completely different to a stressed-out office worker in the city centre. You've got to understand where people are coming from and provide the infrastructure. A marketing campaign could only do so much if it was not underpinned by the right infrastructure. That people could walk or run easily and safely, she said, adding a public health campaign would be the icing on the cake. Yeah, some people can't run in certain areas because they're not deemed safe areas. Like some people are in deprived areas, rough areas, where if they tried to do that, they probably would they could get robbed or nicked or whatever. So you have to take that into account when you want to encourage people to do things. Sports was also cited This Woman's Run, formerly This Mum's Run, the world's largest running community for women, where participants take part in 30-minute groups, walk-ins or running sessions in their local area, as an example of best practice that a government campaign could take inspiration from. Policymakers should encourage people to see physical activity as associated with fun rather than health, to inspire life along a love affair with sports, she added. Yeah. Anything that can help incentivize. Yeah, I love. There's a lot of this stuff here which I really do agree with. We do want to get more people into getting more physical, of course. And it obviously it's not just like I said at the start. It's not just about throwing the money at it. It's encouraging them to do so, finding ways to get past these physical and mental barriers that many people have as well. So obviously the tryout in Wolverhampton, as it said there, didn't really work out. I still think it's still worth trying to push a bit more onto. I think they should be trying it in other areas, maybe to see if it could be successful in other areas. Just because it didn't work out in Wolverhampton doesn't necessarily mean that they can't work out in other parts of England or the UK for that as well. But we need to look at ways that we can help people. Like I say, it's not always about throwing money at the problem, but there are things where money can really help make the difference when it comes to helping people with their physical health. And it is absolutely true that if you are actually doing physical work, if you're actually doing physical exercise and whatnot, it actually does improve your mental health. It really, really does. So if you're somebody who doesn't, do try doing even some of the small basic things, like literally just doing this with your fingers or with your toes, like sort of things. It's just start. I always say start small and build yourself up. That's the best way I can encourage people to do so. But what do you guys honestly think? What do you guys make of Streeting's bid to get Britain off the couch and save the NHS £10 billion? Do you think it can succeed? Let me know your thoughts and more down in the comment section below. If you found this video interesting and informative, hit the like button, share it across social media, subscribe if you haven't already. Do check out Rumble and Patreon for free content on those platforms as well. And if you want to financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p. Just click the join button down below the screen. So thank you all so much for watching, and I hope to catch you all very, very soon.